I decided to take it on because I get a letter or two or five every day from people who have lost their job and suddenly they don't have health insurance. Somebody in their family gets sick and they lose their house. They were solid middle-class folks until they lost their job, and lo and behold, they discovered they couldn't get coverage because something had happened to them before. You know, maybe a woman had breast cancer, and it was okay as long as she had her employer-based health care, but once she lost her job and tried to get health care, couldn't get it. I've looked too many parents in the eye who say, our children have these chronic diseases, and we found out that our insurance only covered us up to a certain amount, and then they hit a cap. And afterwards, we had to hold bake sales, and our neighbors had to raise money just to make sure that our kids would live. Too many stories like that. So that was the main reason that I said we had to take it on. But the second reason was because even if you've got health insurance, what's happened to your premiums lately? Look, if this is a representative sample, I'm assuming that 85% of you right now have health care, maybe 90%. Let's say 85% of you have health care. Some of you are getting it through your job. Some of you are still buying it individually, or you're a small business owner and you're purchasing it. No matter what your situation, I guarantee you your costs have gone up at least double digits over the last year. They have doubled over the last decade, and they're going to more than double over the next decade if we don't do anything. So even if you're lucky enough to have health care, it is digging deeper and deeper into your pocket. They just had, some of you saw the news. For people who don't have insurance through a big employer, the individual market, in California, one of the biggest insurance providers, Anthem Blue Cross, just announced that they were going to raise rates on these folks by up to 39%. Up to 39%. That's the future. That's the future, Henderson. That's going to be one of the main things that helps to bankrupt local school districts, because all these teachers, all these employees, those healthcare costs go up. Universities, those young people who are about to go to college, part of the reason your tuition's going up is because every employee at the university, their healthcare costs are going up, and that gets passed on to you. And finally, the third reason that we had to take this on is because the deficit and the debt that you hear everybody getting in a tizzy about, properly so, the vast majority of our long-term debt is driven by Medicare and Medicaid. It's driven by our rising health care costs. Nothing comes close. You could eliminate every earmark, you could eliminate foreign aid, you could eliminate all that stuff. It would amount to about 5% of the budget. Most of it is health care costs. And as the population gets older, they use more health care, that drives it up even faster. And pretty soon, the entire federal budget's going to be gobbled up by these rising health care costs. And you're already seeing it at the state level here in Nevada, right? What's happening with Medicaid? The governor's starting to talk about having to cut all kinds of aspects of Medicaid because of the cost. So here's my point. We can't wait to reform the healthcare system. It is vital for our economy. It is vital for our economy to change how healthcare works in this country. It's vital. Now, having said all that, the people who were giving me advice at the beginning of the year were right. Healthcare has been knocking me around pretty good. It's been knocking Harry around pretty good. And Harry has shown extraordinary courage because he said, you know what, Barack, we are going to get this done. I know it's costing me politically, but it's important. It's the right thing to do. That's what he's been saying consistently, and I'm proud of him for it. So let me, just very quickly, let me describe what it is that we have proposed, and I'm waiting to see what the Republicans propose in turn, because there's been a lot of misinformation here. What we have said is this: if you have health insurance, we are going to pass a series of health reforms so that the insurance companies have to treat you fairly. It's very straightforward, that they can't prevent you from getting health insurance because of a pre-existing condition, that they can't put a lifetime cap so in the fine print it turns out that you're not fully covered. So there are a whole series of insurance reforms. That's number one. Number two, we've got a whole series of cost controls. So what we're saying is, for example, that every insurer, they've got to spend the vast majority of your premiums on actual care as opposed to profits and overhead. We're saying that we've got to get out some of the waste and abuse, including subsidies to insurance companies in the Medicare system that run in the tens of billions of dollars every year. That's not a good use of your taxpayer dollars. And we're working to improve wellness and prevention, as I said before, so that people aren't going to the emergency room for care. Now, the third thing, and the thing that's most controversial, sadly, is what we're also saying is we've got to make sure that everybody can have access to coverage. And the way we do that is we set up something called an exchange, where essentially individuals and small businesses who aren't getting a good deal because they don't have the same negotiating power as the big companies when it comes to the insurance market, they can pool, just like members of Congress and federal employees do in their health care plan. They can pool so that now they've got the purchasing power of 1 million people behind them, and they can get a better deal. That can lower their costs, and will give subsidies for working families who can't afford it, even with lower premium costs. Now, so I want everybody to pay attention next Thursday when we have this healthcare summit. You may not want to watch all 6 or 8 hours of it. You got things to do. But pay attention to what this debate is about, because there's been so much talk about, death panels and adding to the deficit and this and that and the other. Pay attention, because this is what we're proposing has nothing to do with the government takeover of health care. Most of you would have the exact same health care that you've got right now, but you'd be more protected and more secure. And if you don't have health care, you'd have a chance of getting health care. And by the way, it would actually save us money in the long term, because all those wasteful dollars that we're spending right now, the experts estimate we'd actually save $1 trillion by passing it. Now, I think it's the right thing to do. The Republicans say that they've got a better way of doing it. So I want them to put it on the table. Because as I told them a while back, look, I'm not an unreasonable guy. If you show me that you can do the things we just talked about, protect people from insurance problems, make sure that the costs are controlled, and people who don't have health insurance are covered, and you can do it cheaper than me, then why wouldn't I do that? I'll just grab your idea and say, great, and take all the credit. I'd be happy to do it. So show me what you got, but don't let the American people go another year, another 10 years, another 20 years without health insurance reform in this country. All right. Okay. It's a gentleman's turn. It's a man's turn. This guy over here. This guy with the beard.
Thank you, Mr. President. Ben Burris from Jonesboro, Arkansas.
What are you doing all the way here in Vegas?
Everybody comes to Vegas.
That's what I'm talking about. There you go. Everybody comes to Vegas. Yeah. Now, here's my only question. Ben, have you spent some money here in Vegas?
Oh, yes, sir.
Oh, he says yes, sir.
Yes, sir.
He's spending some money here in Vegas. All right. That's good. We like to see that. All right. What's your question?
Well, sir, I'm reasonably familiar with the current and proposed legislature as it applies to dentistry and oral health.
Yeah.
And my question is, what's your vision for how dentistry will fit into your larger framework for health care reform?
Well, are you a dentist yourself?
Yes, sir. So if somebody has a heart attack, you better still call 911.